Hello, my name is Xin. My topic of the presentation is patient psychology. Appropriate medicine, no matter in which country, is irrefutable medical standards. However, understanding the patient's psychological needs to help them get rid of the pain is the necessary content in modern medical schools. As patients, they would not be indifferent to occurrence of disease, progress, and prognosis. Would care about doctor's treatment plan, injections, medications, and examination, and would think about the life, the work, and the society adaptation after a disease. So it can be said that the patient's psychological, physiological, and treatment complicatedly combine together, influence each other, and restrict each other. Therefore, I put forward the topic of patient's psychological. Here is the manual. I will talk about the four topics. The first one is the meaning of the meaning and the value. The birth of the patient's psychology is a product of transformation of contemporary medical modern and important content. A doctor who could not understand the psychological activities of patients just can say is half of a doctor. I worked as intern in hospital for 1 year and I'm working in dental office. I have same experience like most of the clinical healthcare workers. For two of the patients who have the exactly same disease and applying the same treatments, if their psychological condition is different, outcome is really completely different. Even the same patient who is in different period of mental states also seriously affect the treatment impacts and outcomes of the disease. Medical workers understand the patient's anxiety and fear and the test result, the condition of body, the simulation, the effect of the medicine and illness repeatedly, then play a leader role in improving the relationship of doctors and the patients. The second one is the objects and the property of patient's psychology. The patient's psychological behavior is associated with clinical treatment closely. It is a branch of the medical psychology. It studies on the relationship of the lore of the patient's psychological activities, the state of patients when they were suffering the disease, and the occurrence, development, treatment, and outcome of disease. The third one is the range of and the content of patient's psychology. Patient psychology system can be divided into two contents. The first one is a summary. The performance of the patient's psychological type, which can be roughly classified into six types. The first one is the body disease caused mental disorders. The second one is the mental performance caused by the treatment. The third one is the psychological problem leads to the body disease. The fourth one is the psychological reflection to disease, such as anxiety, depression, and the despair, and for the various heart syndrome. The fifth one is the psychological reaction to the treatment or environment. The last one is the mental disorders of the psychological disease. The second one, I'm talking about the main factor of the patient's psychology. Such as general body disease patients perform passive dependent, sensitive, while mental illness have such as sensory disorder, affective disorder. The object factor influence the patient's psychological. Disease is the main pressure of patient's psychological. 4. The general needs of the patient's psychological is diagnosis as soon as possible. However, depends on my own experience. Diagnostics is certainly important. Patients patient's psychological needs also include a high level and better condition for treatment. 5. The psychological effect of patient's psychological. Study shows that mental activity is through the influence of the central to plant nerve, endocrine, immune systems, and neurotransmitters. Patient's psychological system can be divided into two contexts. The second one is a theory. The patient's psychological theory can be divided into three parts. The first one is the formal psychological before illness. The second one is the psychology after illness. The third one is the psychological of seeking medical treatment. All of those patients' psychological performance have relationship with the progress, prognosis, outcomes, and the recovery. The method to study patients' psychological. Medical psychology search methods include observation, experiment, investigation, case, and the psychological measurement. All of those can be used to study the patient's psychology. So, like the epidemiological investigation, clinical observation, psychological tests, animal experiment, and a case study. After doing the research of the patient's psychology, I'm so glad that I chose this topic. Around 5 years ago, during the period I worked as intern in hospital, and right now I'm working in dental office. I totally understand how important the patient's psychology is. Sometimes knowing what the patient think, why they have this feeling, and how can we help them are important than any treatment plans. A lot of true examples shows us that the patient's psychological performance influences the progress of the disease. Combining physical and psychological knowledge is really useful for health profession work in clinical practice. That's all. Thank you.